So shall we call the meeting for order?
We are now ready. Someone would like to make a motion to call the meeting to order.
I will.
Okay, would someone
I
second?
second it.
Thank you. Okay, just to read this paragraph about virtual meetings. Pursuant to Chapter 20 of the Acts 2021, an act relative to extending certain 19 measures adopted during the state of emergency, signed into law on June 16, 2021, this meeting will be conducted via remote participation. No in-person attendance by members of the public will be permitted. This meeting will be live streamed, but we'll have an option for public participation. To view, listen, go to the Northborough remote meetings on YouTube. There's a link, which I'm not going to out loud because I'll get the letters wrong. Okay. But there's Northborough remote meetings on YouTube is an option. We're going to do quickly a roll call. When I call your name, say that you're in attendance. I'm Sandy Scott. I'm in attendance. June David Boers.
June David Fours, I'm in attendance.
And Gretchen.
Gretchen Bean, I'm here present at the meeting.
Thank you, Doreen.
Doreen Jenna, I'm here at the meeting.
Thank you. Haley
Present.
and Dawn.
I'm present.
Clemente.
Oh, she said she's present.
I'm
Oh,
present.
sorry. Okay, thank you, Haley. And June, John.
Joan
I'm not sure
Clemente,
if I heard
present.
you. Thank you.
Yes, present.
Great. So date of the next meeting?
Well, I had a question about it because I don't remember if we met in December. The next date would be December 16th. Do people remember if we meet in December?
I think we normally,
Yeah, I'm sorry, go ahead.
my recollection is we do. Is that your recollection, Sean?
I actually thought we didn't, but I'm
Didn't.
good with it. I thought we did not, yeah.
I think, if it's around, it's one thing if folks are going to be out there, if it's, if we feel it's chaotic, which it's certainly is in December, really, I think, what do folks think? Does anybody have an
I'm good.
opinion?
I'm good. I don't have my date book right here, but I think that would be fine with me.
Okay.
If you hold on, I'll just
It's
grab my
fine
date.
with me.
Yeah, I'm fine to meet in December.
Okay, good.
Okay, we'll go ahead and why don't we schedule it, and if we get a lot of feedback, otherwise we can reconsider, but
Yeah, so December 16th.
okay.
And I just checked, this is Joan. That's, excuse me, I don't know if you can see my name pop up when I talk or not.
No, we
but I'm
just
good.
get phone number.
Oh, okay. So I'll identify myself. Yes, the 16th is good for me as well.
Good. Great. I did not have a chance to do the minutes, so if we can go over them the next meeting.
Okay,
Of
be
course.
helpful. And this is not on the agenda, but I just emailed all of you the proposed schedule through December of 2022. So if you could all look at it and see if there's any conflicts, that would be helpful. And we can talk about it at the next meeting.
okay.
Okay, this is Joan.
Personnel update, it's pretty similar, except Ayako, November 30th, Ayako won't, after November 30th, she won't be coming into the office anymore, but she's willing to do some virtual work from home. So that's going to be helpful. And Doreen, as I said, is very slowly reintegrating. she's doing remote work and she's coming into the office one time a week. So it's kind of nice to see other people. So it's been really busy, but you know, I'm doing it, but it's pretty hectic. So in terms of the follow-up to the questions that Youth Commission members had, I had a conversation with John, and I told him, you know, the need to want to meet with him and the questions and concerns. And he wants to directly meet with the whole Youth Commission, which I think would be great. He couldn't give a time right now as to when he could meet, but he couldn't come tonight. But I told him I wasn't sure if we were going to do the December meeting or not. So I can ask him for that meeting, if that's good.
Sounds
I
good to
think that
me.
would be,
Yeah.
yeah, that would be great. Of all
Yes.
this time, I've never met him. So
Oh,
with
my
all-
goodness. Yeah.
Yeah.
Oh, good. I think it's a great opportunity too.
I do too.
Good. So we've been receiving calls from the schools. What happened is I was going to see a child in the middle school who was very resistant to getting counseling. But I think the schools must talk. and, you know, so it's like, I got like 3 other calls from people from different schools. And so what I'm doing is, you know, I always tell people to try Interface first. You know, it's a great resource that's really helped out the department. But there are some cases that make sense for us to pick up, like people can't afford, you know, insurance deductibles went way up over the last couple of years, and some people just can't afford that. So that's what's happening with that. Yeah, I didn't have too much else to report. I'm really pleased that John's going to meet with all you, and I think that's going to be a great step.
Yeah, that's great.
Good.
I think that we all appreciate he's going to take the time to do that.
Mhm.
Is
So do you know-
this,
oh,
sorry, Joan,
sorry.
go ahead.
I was just wondering, you know, before the meeting, if he answered or has any indication what his response was from the letter written last year.
So what he was saying is, it was when I was out, and you know, that he thought waiting for me to come back would be best.
Yes, but you're back for over a year.
Yeah. So I think that will be addressed at the meeting.
Okay.
Yeah, good.
I was going to ask about the selectman who was on our meeting last week. I wonder if she could join the meeting as well.
Mhm,
Just curious.
So
mhm,
that would be good. Yeah.
mhm.
Yeah.
June, this is Doreen. Do
Yes.
you know that woman, is it Kristen or Kirsten? Is she supposed to, since she's a liaison, is she going to be joining us every meeting? Or do you have any idea how often she's supposed to be part of our meetings?
Yeah, you know, it's totally up to them. As I had said, in the 15 years I've been here, there's only been a couple of selectmen who've come to a meeting or two. So I'm not
Yeah.
sure.
I've been on the youth commission for I don't know how many years, but Joe, you probably have, you could even tell us more. We had, in my experience, we've had one visit, one each from two other select persons. And this is the 3rd time I've seen a select person at a meeting.
Mhm.
And that was it. You know, they dropped in, we saw them, they saw what we did, and never saw them again.
Mhm.
So,
Yeah.
Mhm.
I hope that this
That-
is, again, a person will be a little more engaged, but we'll see.
Yeah,
That's what I remember too. But she had some action items. Did she give you an update or anything, June?
Will you refresh my memory on that?
Yeah, I'm trying to remember right now what they were. I
know
just can't remember.
Joan, wasn't she supposed to look into those funds, the Agra funds or the ACA
Oh, she
funds
wanted
and-
to learn more about them. Yes,
That's
and I have
right,
it.
one of them.
Yeah, and I have an update on that. There's been all this, like, it's like a big mystery about them. And so at our staff meeting, John gave us a 2-page, I guess this fund is like hundreds of pages, the description of it. John gave us a 2-page summary of it and explained the process, which was very, very helpful. These funds are for a variety of things, but the main thing is to restore the money to the towns that they lost or had to use because of COVID and because of personnel issues and other expenses. So that's the priority. What John said is there may be some other grants coming in. So, he's going to go a little slow on committing all of the money, not all of the money, but some of it, because if grants come in, then he can use that money for other things. But he also said, because I've asked about the human service piece, and he also said that as I think this grant is for 3 years, but he said as we're, getting close, he'll talk to people about other needs for the money. So it was helpful to get clarification on the process, because every town's doing it differently.
Yeah, sure. It is good to get clarification, but disappointed in the response
Mhm.
or the answer, I should say.
Yeah.
June, I think you probably would have mentioned it, but I wondered, so is Ayako's position posted yet, or have you gotten any interest?
No, it's, as I said, Becca's great about getting this stuff out. There's a lot of positions in town that are open right now. And she's really good about I'm also on the committee to hire the senior center director. And surprisingly, although this is what's going on in the country, is that they haven't gotten a lot of resumes for that. And that's usually a pretty good position to get and work with. But nothing for the counselor. And as you know, it took over a year to get Ayako. So
Boy.
yeah, but it's been advertised for a while. And her and I talked about also putting it in like the National Association of Social Workers. We can advertise in there, and it's pretty cheap to do it. So I sent her the information about that.
I think maybe one of the other parts was, I don't remember the select woman's name, but she was maybe going to talk to John about Ayako's position being what it was before, assistant director or full-time.
Mm-hmm.
Was that one of the things she was going to do?
That definitely came up.
Mm-hmm.
And I think, I believe her name is Kristen Wixted, right? Is that right?
Yes,
Yeah.
yes,
Okay. Thank you.
yes. I'm not sure. Her and I had met before the last meeting to hear about the services. I don't know if she's talked to him or not about it.
Oh, okay. She didn't get, okay.
Yeah,
Thank
yeah.
you.
June, I wondered, I don't know if this is on an agenda or if I missed it. Where are we with student liaisons? Has that any
Yeah.
updates?
Yeah, so I had asked, Jen had said she could do that,
Right.
but it hasn't happened yet. And I was thinking she got into a new position. She's not, it sounds like she's floating across the district. So I was gonna ask Lisa Connery, who's the head of guidance up there, the whole department, if she has any suggestions. And the big question is, where is that? I mean, I have copies of the applications from the past, but I know Becca is the one who would get it out to people.
Yeah.
So I will
Becca
follow
was-
up with
was-
Lisa. What's that?
Becca was instrumental in, I think,
Absolutely.
guiding kids to us. Do we, not all of our previous liaisons have graduated, have they? Wasn't, oh, they have?
Yep.
Oh, I
Yeah.
thought one of them was still, okay.
Yeah,
I
so,
thought there was some,
Sivan in the
I
last year of college, she can become liaison again next year.
who's that, Gilly?
In the last year of college, so she might come back again.
Oh, yeah.
next year.
Oh, how's she doing?
She's doing well.
Good, good.
Yeah, I lose track of how many years. I feel like COVID, was that whole
Yes.
lost
Yeah.
year, that
Yeah,
I think
That
that's
whole-
it, you know?
quarantine.
Yeah,
Definitely.
yeah.
definitely.
Adding a year to everything so that
Oh, I know. It's,
Easy.
the question they ask when they're doing a mental health assessment is, are you oriented to day, time? And it's like, sometimes I'm like a week off because it just has warped everything, And every day for a while was the same. It was like Groundhog Day, that movie where you wake up, it's the same and it's the same.
I have to tell you, with old people is even worse. My mom is close to 90 and she is completely off her schedule. She
Yes.
always getting mixed up.
Yeah.
She grew so old during the pandemic.
Oh, yeah. It's
Yeah.
terrible.
Yeah.
Yeah, I'm just amazed that something like this has had such a profound impact on the whole world. It's
Well,
just,
it really has.
I didn't think in my lifetime something like this would happen. It's in the past. It's in, all those other flus and pandemics.
no, I didn't think so either.
Yeah, I know it. I know.
June,
So-
I had one
Yeah.
other question, sorry, before you move on. I just was curious. I know a little bit about the Family Success Partnership,
Mhm.
but I wondered if you could talk about, is that connected with you? How does that work? And I don't know if the other members know about what that is. So if you could
Yeah.
maybe.
Yeah, I'd be glad to talk about it. So Family Success Partnership has been through the schools. It covers a couple different towns, but it covers Northborough, and the schools have supported it. It started off, I don't know if you remember Nikki Logan. She started the whole program, and so the schools were supporting it at first, and I'll tell you what they do too. But she got this Robert Wood Johnson huge grant that supported it for several years, and that has run out. So she has left since then. But what they do, first of all, the only way not the only way, but we could recommend to the school that we think that a student, or family might need these services, but the school is the only one who directly refers to Family Success Partnership. And we have worked, with their counselors for several, we share similar cases, and they're sort of there to prevent families who might go into DCF, Department of Children and Families. And they do a lot of case management, trying to hook people up with services. They'll call us, we'll get services for the families and benefits. And I think they cover at least 4 other towns, Marlborough, maybe Hudson. So all those school systems have pitched in for it. They'll find counselors for people, psychiatrists, a lot of resources and referrals. I think they have a little bit of money to help families with unusual costs. Like I know one family who had to get a dumpster to remove some stuff from the home, and they may have paid for it or found someone who could do that. So a lot of brokerage with other agencies. But I'm surprised that a lot of school people don't know as much about it. Oh, I know what it was. Lori Pardee was sort of the point person. Now, I don't know if Mary Ellen is. They're the lead nurses in the school, throughout the school district. And, we would go through Lori, but a principal can go and say, we think this family needs the service.
Yeah, no, I've heard about it
Yep.
through the school, and it seems like a great resource.
Mhm.
And I just wondered how, if at all, it was connected with you or,
Mhm.
completely independent. So that makes a lot of sense.
Yeah,
But you
so
know
in-
them and you can,
Yes, we collaborate with them, but we're not officially.
So do
Yeah.
do they still have a grant or is it over?
What's that, Joan?
Is there still a grant to cover some of these resources or?
I
grant-
yeah, I know that big grant ran out. I know the schools are supporting this. I don't know what other grants they get to support it, though.
Oh, okay.
I think that the towns that are involved contribute some, but I don't know about the rest of their funding, especially since that grant, ended.
And the other interesting thing about them, and I can't say with 100% surety, but I've worked with a couple of other counselors, and they basically follow the school calendar year.
Yes.
So, for instance, there was one family that a counselor was working with, and she got in touch with me in June, like mid-June, and she said, I'm only going to be working until like the last day of school or whatever. So I
Yeah.
don't think they do provide any services over the course
No.
of the summer.
That's a good
Okay.
point, Doreen. They used to be year round. So what happens then is we may get referrals from them because, we really miss having them there in the summer, but
Mm. And I don't know if this is next on the agenda, but did I read that there's, and I don't remember the name of the referral service that we have in town that we pay for. Has there been problems with that, with some of the people seeking support from them?
have you heard that, Joan?
No, I thought it was brought up last month.
Oh, Jen. Yeah, Jen mentioned it.
Okay,
That's-
but I have not heard that. I was just wondering if we've heard any more or if it's, was just that one-time glitch.
A couple times throughout this contract, I've gotten calls from people, either like school people or people in town that are saying a person's having a hard time getting through. So I'm really glad when people call me with that, because I called Tanya Snyder right away. She gets on it and follows through with her staff. So that's why, I stress to Jen, please call me or have those families call me and I'll run interference. And I've always found Tanya really, really helpful. Now,
Oh, that's good.
yeah, I don't know. I do know during COVID, their numbers spiked and they have a huge database of counselors and services. And so they actually had to close down for 1 week to kind of get organized, which is unheard of, but due to COVID and the demand going up.
Yeah. Thank you.
Yep. I think that's all I had. I don't know if there's other issues in the community that board members might be aware of, or themes going on in the schools or community.
No, Jen,
Well, for
just
me,
go ahead, Joan, sorry.
I have just been hearing an increase of problems with alcohol. Not necessarily drugs, but alcohol.
Yeah, yeah. I just, I get information on my phone from different organizations I'm involved in. And there's been a huge increase in fentanyl deaths, that people are getting drugs that they don't totally know what's in it, and huge spike in numbers of who've died. It's funny because I think for a while we heard less about substance abuse issues because everybody was closed up and people weren't really reaching out to the rest of the world because we were kind of hunkered down trying to stay safe.
Yeah.
Yeah, but the need is still out there, and I'm on that Northborough Southborough Substance Abuse Coalition, which is a result of the Metro West Adolescent Survey for adolescents. I think they did middle school students too. And what came out and how this coalition got developed is Northborough, Southborough, Ashland, Framingham, Natick, and Hudson. Out of all Central Mass, the Metro West Health Foundation said that our towns were the highest in youth. And some thought is, well, some communities that are rich, kids have more access or ability to purchase it. But the other big issue was that there were a lot of students who did not have an adult this is a while ago, in school or out of school, that they could turn to. And Search Institute, there's kind of the head of all this through the nation about substance use in kids, said that not having an adult in their life is a key indicator that they may turn to drugs. So the schools did a fantastic job. This was a couple years ago. They created, and Gretchen, you can talk more about this, but they created a morning, I think it was like a morning check-in with students, and had students lined up with specific staff members. Am I saying it right? Is that how? And so that got taken care of on that level, but still outside of the home, outside of the school, it's still lacking. Now they just did another survey. I think they do it every 2 years, but we haven't gotten the results yet from that. So we'll know more soon.
We actually just administered it a couple of weeks ago, but we had trouble because for the first time they administered the test electronically.
Oh no.
And their server was overwhelmed.
Oh no.
So yeah, so we weren't able to get the data. Yeah.
Oh no. Are they going to try again?
I'm not sure the next steps, but yeah, that was pretty disappointing. So we'll have to see what happens.
Definitely.
But yeah, no, I remember when that data came out June about the kids feeling connected with an adult, and yeah, that was pretty, eye-opening for us.
Yes.
To think about. So yeah, we have definitely worked toward it. And Jen Lipton, our member, she's actually now, she's in charge of social emotional learning in the district.
Okay.
Yeah, she's got a big job. Yeah, so she's great. And she actually just presented at our faculty meeting on Monday, just about really thinking about the whole child and how important social emotional learning is to them, especially in the middle school grades.
Oh yeah.
Especially now, with everything going on. So yeah, I know she did a lovely presentation. It's good. I think it's great how much the district has sort of invested in that aspect of school.
Definitely. And I hope they can get the statistics because it's going to be very interesting to see how COVID has
Yeah.
impacted all of this, you know.
Yeah, it will be interesting, but yeah, more parents are at home or, yeah, it'll be very interesting. I
Mhm.
hope it's not bad news.
Yeah, and I
You
mean,
know-
when we were, you know, it was hard not to think about kids when we were in like the true quarantine, you know,
Yes.
lockdown or whatever. The kids whose parents, you know, had to go to work and the essential workers. And, you know, so I think I know
Yeah.
there were kids who did not have, you know, adults at home with them.
Oh,
So I think about my own children who had me with them
Yeah.
Yeah,
and how, you know, they still miss their friends so much. I can't imagine what it would
yes,
have been like for kids who didn't have a person who takes care of them at home.
exactly.
I didn't
It
even
was
think
it. What, Joan?
I didn't even think of that about the essential workers who had to go and
Yes,
daycares were, and oh, gee.
I
and you know,
know.
on the
Yeah.
flip side of that, I work with people who are home. They're trying to do their job full-time from home, and they have 3 little kids. And they're trying to be teachers, daycare,
Oh,
and
Yeah.
hold
yeah.
a full-time job. I
Mhm.
mean, no wonder having an alcohol problem and drug
know
problem.
it.
I mean,
I
because
know it.
I
yeah,
know.
there's
hard.
this stress. The stress is unbelievable.
It really is.
It really is.
On the flip side, I've heard my neighbors, you know, the mom was home with them. She can do work from home because of her husband's business, but of course, they were home, you know, being in school remotely, but she was home a lot more, and the kids we're so glad you're here more. And, you know, it was really, really nice to see. And I think sometimes, I can't imagine being a parent nowadays, but I think sometimes with all we're caught up in pre-COVID life, you know, this one going there and that one going there, just to have some downtime, learn to have downtime and be okay with it has been great. I think for families, it's one of the plus sides of all of this.
Yeah, no, I see that too. I agree with that.
Yeah.
So I don't think I had any other topics to discuss. I don't know if there's other business.
So I was thinking
Well,
maybe for next, sorry, Joan, I feel like I keep interrupting.
No
No,
problem.
I was gonna say, I mean, thinking for next time, I mean, maybe if you can reach out to, is it Lisa Connery
Yes,
at the high school for our
Mhm.
student liaisons? That would be great. And then, yeah,
Yeah.
definitely looking forward to meeting with the town administrator. I think that'll be very interesting to hear about,
Yes.
you know, what his take is on some of this stuff. So that sounds good. I think that it'll be worth having a December meeting for that. Hopefully he can
Okay.
come.
yeah,
Yeah.
great.
And then, I don't know, Joan, could you maybe mention to Kristen Wixford that
Mhm.
John it would be good if she'd be at especially at this meeting.
Yeah, she's a liaison, so she could come to that.
Yeah.
Yeah, yeah, but just for her to know that it's especially important for this. And then, what are you gonna do when IACO is not there anymore?
Well, that's a good question. She's here in person twice a week until the 30th, which
Yeah,
is yeah,
It's coming
And then-
fast.
I know it is. I've been in denial because she
Yeah.
stayed on to help out, you know.
yeah, that was,
Yeah.
Yeah. So she said if she could still work virtually, she'll do some of that. She's been doing like the shorter term things like helping people with applications for fuel assistance. So that's been helpful. It's hard being here alone in terms of answering the door and answering the phones, but you know, that's definitely missed with Doreen being out. And Ayako not being in the office as much.
yeah,
but-
yeah.
Yeah.
Yeah,
So is the town closed? People still come into the town hall?
well, they can come in to like, no, it's open, but we have like these, they cut out the door and we have, you know, like at a bank, you get that plexiglass, although I'm sure they
Yeah.
have something stronger than that. And with like a slider, if people want to give us, like a lot of fuel assistance people will come in because they have to give us the paperwork, you know, that they filled out. And then we have to complete the one-page application. So,
see.
yeah,
So, that's gonna be really hard. And I know, trying to get personnel is very difficult nowadays.
I
Is
know.
there any, yeah, is there any way you could get like a consultant or,
Hmm.
a part-time, not somebody that's a permanent hire,
Mhm.
but somebody just, do we hire somebody or do you
Mhm.
hire somebody?
Like, what are you thinking, Joan?
Well, I'm just thinking maybe even, it could be as simple as a high school student who could
Mhm.
help answer scores and
Oh, I see
fill out
what you're
the,
saying. I
yeah.
see what you're saying.
Yes, somebody
Or-
like, I was gonna say, do some of the paperwork, bill assistance or, things like that, maybe.
Yeah. Or to the other extreme, having, an educated person in your field to,
Mhm.
I don't know, maybe pick up some impromptu counseling or crisis management or something.
Mhm.
Well, the
You know,
biggest,
and
the
until
biggest,
you get your permanent hire.
right,
I can't see you for a year.
No, that will not be a good situation.
No.
Regarding the fuel assistance, it's only open for, there's a window. And I think it closes either the end of March or the end of April. But I have to tell you that the applications are extensive. Since I've been there, because I started in January of last year, so I was there at the kind of more towards the tail end of the application, application open the window, and I still don't even feel comfortable 100% with helping people fill out the applications. They really are very extensive. So it would be difficult to just have somebody come in. I mean, not unless they knew exactly what they were doing, as far as maybe they've done it before. I think that having somebody come in, and I think it's a great idea, Joan, but I just don't know if it would be really feasible.
How about
That's good to know,
a interim counselor?
Well, it's a good idea, Joan, but I don't think if people aren't applying for the position, that, you know what I mean? I don't,
I do.
yeah, no, I appreciate the brainstorming around this because I'll be surprised if we hire someone soon.
I think the only thing that might have really helped out, June, is perhaps if we had another intern, like,
Yes.
then that definitely could have helped, depending on how long they had been
Mhm.
here, with the department.
Yeah. The reason I chose not to take one this year is we had one last year from William James College. He was great. I love taking interns from them. Because they're working on their PhD, so most of them already have masters or have a lot of experience. The problem was when he came with COVID being in place, there just wasn't the work for him. He did get a couple cases who he worked with virtually, and he did a great job with them. But the demand just, people were like hunkered down, and we didn't get a high demand right away for our services. So,
I see.
yeah.
Did you get somebody like for January with the new semester starting? I mean, do you think?
Yes, sometimes they look for that. Yep.
The thing is, we don't know, what's going to happen with COVID.
Mm.
Yeah.
Yeah, what are you hearing about that? It changes all the time, but what's the latest you're hearing?
Well, the latest I heard was, the cases are high in New Hampshire and Vermont,
Mhm.
and one step down is Massachusetts.
Oh,
And that's
okay.
and the positivity rate is climbing again.
Mhm.
It's
Yeah.
like, over,
Mhm.
I think in midpoint 2%,
Mm.
which, is not good, and the holidays are coming on. So, who knows?
And
with,
people are gonna be doing a lot more traveling during Thanksgiving and the holidays. And that's what they
And I
keep
heard-
saying.
Exactly, right.
Mhm.
Everyone's getting tired of it, so people are just
Mm.
throwing caution to the wind.
Mhm.
Crazy.
Scary.
Yeah.
It is. Especially when people are getting it after being vaccinated.
Oh, I
Yeah.
know.
Yeah. Well, it's also new too, and I won't be surprised if in a year they have even a better vaccine. I mean, this came on so fast.
Yeah, you're right.
Mm.
But we have to get them into people's arms too.
We have to what?
Get the shots into people's arms. There's a lot of people in the country, as you know, who are
Yeah.
still,
That still aren't
going-
doing it.
Yeah.
Mhm.
I actually got my little boy vaccinated at the clinic that they had at the middle school. It was great. It was so well run.
Oh,
It was really great. It was so sweet to see the kids, getting their shots, and
Yeah.
then they were taking
Oh.
their picture at the end. I'm doing my
Oh.
part, and they gave them,
Aw.
stickers, and they had like coloring
Oh, yeah.
pages with, because you have to wait
Yep.
the 15 minutes. So
Who
it was
ran it,
really.
Gretchen? Did the fire
Um,
department?
Uh,
Some other-
I know that there were paramedics from different towns
Oh, okay.
there helping. I know that Dr. Medina, the school physician, was there, so that
Yep.
was nice to see him
That's
there.
nice. Yeah.
It was really well done, and it was, seamless. Check in,
That's
go
great.
up, get your shot, then go back into the waiting room area. But it was really,
That's
it made me
great.
feel like I wanted to cry. It was so nice to see,
Yeah.
Oh, yeah.
the kid.
And I
little
bet you a
kid.
lot of them want them because everyone else is getting them. Why can't they get it?
Yeah. And you can just see parents. It was, it's been such
So
a stressful
relieved.
time, and just,
Oh,
that
yeah.
little bit of
Mhm.
relief that, even the little ones are, it was so
Yeah.
funny to see like really little kids, 5 is young, they look.
Yeah.
Yeah. Is that the bottom age that can get them 5
Yeah,
through 12? Is it?
Yeah, there was a little family sitting behind us, and two little 5-year-olds.
Mm.
So it was
Oh.
nice.
When did they have that, Gretchen?
So it was, I think, the last weekend, whenever it was, we got the go ahead from the CDC, I think, midweek. And I'm
Mhm.
pretty sure that Saturday they had it up and running at the
Wow.
middle school. They
That's
had a
amazing.
movie. They had a movie. They were showing a movie
Oh,
in there
perfect.
too. Yeah, it was great. So it was
Perfect.
really, it was really well done. And then I know they did it two weekends in a row.
Oh, wow.
So yeah, it was
Did
good.
they get
Great.
do you think most of the kids got it?
It looked like it. It
Mhm.
seemed like people were there. You had to sort of pre-register.
Mhm.
So
Oh, right. So you
parents, I
know.
think, had made their decision to get the vaccines for the kids. But yeah, it was really inspiring. So hopefully we're getting to a better place.
Yeah. Yeah. Well,
Has anybody heard anything on vaccinations for children under 5?
I haven't heard anything. I mean, I know it just
Yeah.
takes they try to be so careful with all the vaccines, but in
Mhm.
particular, because I think from the sense I got from my experience is that, little kids are fairly, unfazed. That's true based on like anecdotal evidence I've heard, but also
Mhm.
like statistics, little kids are not really getting super sick. So makes sense, you know, that we wanted to get the
Yeah,
older
yeah.
people, the most
Mm.
vulnerable, sorry.
And this evening, they had on the news that Massachusetts and Utah have now okayed giving the booster shots to anyone 18 and over.
Oh, okay.
Oh,
Yep.
they did? Oh, that's
They
good to
did,
know.
yep, today.
That's great.
I saw that too. Yeah,
Mm.
really good. So hopefully next time we meet, we'll see if things are really changed again in a month.
Yeah, yep.
Yeah.
I know. You don't know what to expect. You just expect that it's gonna change.
Yeah.
Okay. Oh, I'm sorry, Joan, what were you saying?
No, I was just saying, it's tiring, the COVID experience.
Yes,
for
it
Yes, it
everyone.
is. It is.
Mhm.
Do we have any other business? Someone like to
No.
make a motion to adjourn?
Motion
I
to
will.
adjourn?
I'll second it.
Thank you. Okay, I think we're.
Thank you
done.
all very, very much.